Welcome. Oh, there we go. It started. So welcome. My name's Katrina Sanchez. I'm one of the speech pathologists at the NAPA Center. I'm the feeding department supervisor. So a lot of families that inquire about feeding and everything kind of come through me. So this is a bit of a part two to the first part of the presentation we did, which Rhonda recorded. So if anybody is interested in watching the first part, you can speak to her, but you would be perfectly fine starting from here as well. They don't necessarily go exactly, they don't go necessarily in order of needing each other. So this presentation is called Let's Talk Feeding. So we're going to be talking a little bit more about therapy tools and some of the resources that families were requesting in our last presentation. And Mickey presented with me last time as well, but she wasn't able to be here today, so I will be presenting. Okay, so a little bit about us. We're, like I said, our clinic is called the NAPA Center. It's the Neurological and Physical Rehabilitation Center, where we follow a multidisciplinary team approach where we specialize in intensive model of therapy for children with complex neuromotor disorders. We also provide traditional therapies as well. Our intensive programs consist of OTs, PTs, and speech, where OTs and speech do feeding. And we started a new intensive feeding program that we do 2 to 5 hours of daily feeding, 5 days a week for 3 weeks. Each child, in our clinic, each child has their own individually tailored program, so it's not necessarily set a certain way. We gauge each child's needs, and then we base our program off of that child and what they need. Like I said, we launched our intensive feeding program last year, which is a 2 to 3 hour multidisciplinary program. And we have clinics all over the country and abroad in Los Angeles, Boston, Sydney. And we just opened up our Austin clinic that opened earlier than expected. So now in September, they just opened. Okay, so we're going to go on to what is on our agenda. So we will be focusing on, like I said, treatment strategies. Some of the strategies have to do with postural support and alignment and some oral motor exercises. We'll be working on or talking about some feeding modifications, different tools that we use in our practice and that we recommend for families to use in home, as well as some food modifications. We will discuss some tips for feeding in home and then provide some online resources that should help you continue on your journey through feeding and swallowing. Okay. So let's start with our treatment strategies. If anybody has any questions at any point in time, I really would love for this to be a bit more of a discussion. Feel free to jump in and ask questions, and you can type that into the chat area. And Rhonda, if I'm missing any chats, just feel free to jump in and let me know to check as I read. Okay, so we're going to talk a little bit about posture and alignment. So posture and alignment with feeding, oftentimes we forget and we focus so much on the mouth, and we don't think so much all the time about how the child is sitting in their chair, where they're sitting, and what they look like. So it's important to know that breathing is the body's priority over eating. So oftentimes we think we'll eat, or a child will eat no matter what, but no, if their body is not positioned correctly and they're not able to breathe safely and efficiently, then the feeding and the eating portion is going to be affected. So things to keep in mind is seating the child with more support in their head, their trunk, and their legs. So finding an appropriate seating for them. It might be, in a reclined chair slightly if they need that more support with a 5-point harness, support at their feet. Things like that are important to keep in mind. And so some of the exercises I like to do is, rather than starting to feed a child right off the bat in their chair, I often like to take them out of their chair and place them either on a bolster, kind of how you see in this picture. You could place them on a bolster, somewhere that's just slightly different and gives more range of movement for their body to move for this exercise that we're going to do. With the posture and alignment exercises, we provide movement and stretches into the chest, into the ribs, and throughout the shoulders as well, just because a lot of the muscles that go through the rib cage, the chest, the shoulders are also connected with the mouth and the neck that are used for swallowing. So it all kind of connects together. So one of the first, I'm going to show you a set of about 4 or 5 exercises. I'm not sure if you can see me too well through our small little camera, but if anything, I can always send out a better video of the exercises following this. Can you see me okay, Rhonda, where I can maybe just show a little bit?
Yes.
Okay.
Sorry.
So what you would do is, before starting any of your feeding therapy techniques, and this is often used if a child does not have a lot of range of movement, is not often moving their arms or their chest or their body all the time, you would take them out of their chair, sit them, like I said, on a secure bolster of some sort, a chair, something like that, where you can sit behind the child as you see in the picture. So you'll start with your hands on the rib cage, so kind of right here. So you're going to hold the child in front of you by their rib cage, and you're going to do kind of like a sway where it's almost like you're doing a dance. This exercise where I move the child side to side, I'm giving input into their rib cage and trying to just loosen up the muscles surrounding the rib cage. So I'll see kiddos with a pretty tight and up. Their rib cage will be pretty tight and up, just because of the lack of movement and development in the rib cage. So trying to loosen up that rib cage, moving it around. Often you'll notice the child will take a big breath right after that movement, which is nice. You want to increase that breath control. A second exercise that I like to do is using the arms overhead. Again, this is increasing the range of movement and giving some stretch into the muscles that are between the ribs. So keep the child in front of you. You could bring their right arm up. And I would say also do this if the child has any problems, with their joints or their muscles in their shoulders where it's unsafe to bring their arms overhead, then you can bypass this. But if they're safe to do so, then you can bring their arm up overhead and stretch them over to the right side. If their hip is coming up, just give some pressure down on the thighs so that way they could keep their lower body down and reach over to the side. You'll do the same thing holding the child, bring their arm over to the other side. So you're stretching out the ribs, the muscles between the ribs. Let me check if I have any. Okay. The next exercise is providing pressure input on the sternum. So right on the chest cavity, you have a pretty hard bone right here, right? So again, that is an area where I will work with a child, and so many times I see almost like a pointed kind of a sternum. And that is from underdevelopment when the rib cage and the sternum are staying up and tight from lack of movement and core movement. So what we want to do is, again, loosen up that chest cavity. It helps loosen up some of the muscles that are connected to the neck that are used for swallowing and the face for eating. So what you're going to do is put your hand on the child's chest, and you're going to put in some pressure. Again, don't put so much pressure if you know that your child can't take too much pressure on the chest for safety reasons. But if you put your whole hand across the chest, push in with your 4 fingers, and then you're going to push in with your palm onto the other side. You're going to do this rocking motion back and forth. And all of these stretches you can do for about 10 seconds. The way I compare it is to if you're going to go for a run and you're going to do your stretches, you want to do about a 10-second stretch before you move on to the next one. So So you're gonna go back and forth. And I like this one. Often I'll notice a child, if they're kind of gunky or feel like they have some congestion, sometimes it causes the child to cough because it's loosening up that chest cavity a bit. What else? Okay, so the next exercise is a scapular input exercise. So you would start the way you notice in that picture of the therapist with the child. You put your hands on the child's shoulders, and you're basically going to be giving the child a massage, pulling their shoulders back, okay? Your thumbs are going to be going into, I hope you can see here, the scapula is right here. So you're pushing those in with your thumb, with each thumb, and pulling the shoulders back, looking for better posture and alignment. You want the child to be sitting up rather than hunching forward. Okay. Sometimes they're so used to hunching forward that you have to just massage it back and keep massaging it back for a bit until you notice that release. Okay. And the last exercise is a head hold. So what you do is, again, you're keeping the child in front of you. And I'll often verbalize this to the child so that they don't get nervous about me holding their head. I'll just tell them, okay, I'm going to hold your head. So you're going to hold the child's head by the sides where their ears are. And you're going to just suspend the head a little bit, holding it so that it takes the pressure off of their neck. So this, I think, is the favorite exercise of most of my kids, because it just takes that pressure off of having to support and hold their head up. So holding that one there, I usually do it for longer than 10 seconds. And you notice the child will often take a big breath and relax and will focus or attend more so on certain activities. So if you even want to be singing songs while you're doing these stretches, you can have a toy in front of the child and have the child engaged with you rather than keeping it. You don't want to just be doing this work to the child. Do all of these exercises with the child so that they feel that they're involved and they're playing or singing and doing something with these exercises. Okay. Making sure nobody has a message. Okay, we're good. All right, so I'm going to go on to our next slide. And let me grab a charger for one moment. Hold on. Just in case. Okay. So the next exercises these are treatment strategies using oral motor exercises. So a lot of families in our past presentation were talking about, what exercises can I do with my child if they're only maybe taking in a little bit of food or can have scant food taste, or they're trying to just increase range of movement within the oral cavity, within the tongue. So we're going to go through several exercises that talk about use of the cheeks, use of the lips, use of the teeth and the jaw, and use of the tongue. So our oral motor exercises provide the muscles around the face and the oral cavity with input. They help regulate and or increase sensation. So I believe Nancy was talking about, one of the families was talking about how their child feels that they are pretty sensitive to touch on the face. So providing input, even if it's without food, just by using your hands or using some sort of scent, like you can use a towel maybe that has a little bit of a scent of like dipped of juice or something like that, and or even using a familiar like blanket or something like that to feel comfort. You can provide input on the face using something like that, and that sometimes helps regulate and avoid that reaction or high reaction to sensation or touch on the face. And it also helps increase sensation if a child doesn't have a lot of sensation, where they may not feel a lot of movement or touch on the face. Then doing these exercises also helps increase as well. And so just a reminder that increasing sensation, so increasing all that input and touch and smell and texture to a child will help increase and get that motor movement that we're looking for. So sensation drives the motor movement is a really important thing to remember. some of the tools that we're going to be using through some of these exercises. You can use your hands or your fingers. And I'll talk about when it's appropriate to use which. You can use a Z vibe, which is like this guy on the bottom right corner, with the vibration on or off, depending if your child needs more input, you can put the vibration on. Or if the input is too much with the vibration, just turn it off. You can use an Arc Pro Prefer tool, which is the top picture. It's that white stick with the yellow tip on it. And that one is nice, especially if your child has a smaller mouth or oral cavity. That is a nice tip that's smaller and fits a little bit better, is what I found with a lot of children. There's also the Toothette, which is on the right in the center, and that is a soft sponge that you can also use if in case you need something softer that's less abrasive. And if you don't have any of these tools, I'm a big advocate of using things that you have at home. So don't feel the need to go out and buy all of these things. Feel free to use a toothbrush is perfectly fine, or even a vibrating toothbrush is fine. You can use those just as well as any of these tools. Usually these exercises take me about 5 or 10 minutes, depending on how much input the child needs. You can extend the amount of time that you're doing the exercises if your child is just mainly working on getting some more movement before they can have any oral intake of foods or liquids. Then you can just increase the amount of time that you're doing these exercises. And then just as a reminder, obviously consult with your doctor, your therapist before trialing any of the food or drink consistencies that I discuss, and just talking to your therapist through some of these ideas or you can talk with me as well about some of these ideas and whether or not they're appropriate for your child. Okay. So the first exercises that we're going to do are cheek and lip activation. So these are going to be external, meaning they're on the outside of the face. So the first one we're going to do is called the external cheek stretch. I'm going to be trying to do these on myself. Hopefully you can see me through the little tiny video of me. And if you're not able to see it well, please let me know. And I can also provide a short video of all of these exercises done together after the presentation. So the first exercise is the external cheek stretch. So you're going to start with your hands by the child's ears, and you're going to provide firm pressure all the way down through the cheeks and through to the lips. What this exercise does is it targets cheek activation. So for chewing, really any oral motor movement that you need to do in order to chew or to swallow liquids or solids require cheek movement, even though we don't think about it very much. They help maintain our food on our teeth, on our tongue, without it just going straight into that cheek cavity between our teeth. So starting with the cheeks is a very important exercise that I do most of the time. So again, you would start from the cheekbones or by the ears, give firm pressure all the way through the lips, and you do that 5 times. The next exercise is the external top lip stretch. So you would place your index finger and your thumb by the nasal bridge, so right up here, like where you would put your glasses, and you're going to run your fingers down the sides of your nose, squeezing into the top lip. Okay, so you go, and again, it's firm pressure. So you give firm pressure down through the sides, into the top lip, squeeze. Okay, do this 5 times as well. You're going to go through. This targets top lip activation. So if you're drinking from a straw, drinking from a cup, working on lip closure on a spoon, the top lip is typically the important, or the first one to activate in order to help scoop off or close in order to take a sip. The next exercise is the bottom lip stretch. So just like the top, we're going to start with just underneath the bottom lip. And instead of running up, you're just going to squeeze in and spread. And something that I notice a lot of families do is they just kind of go straight over the skin. Don't go over the skin. You're going to hold your fingers in one place and then squeeze the the muscle in and spread the muscle out. You're going to repeat that 5 times. This is for targeting lip activation on the bottom lip. We are going to move on to cheek and lip activation. Okay, so these exercises are more internal. And there's actually, I believe, one main one. Yes, okay. So the cheek and lip activation internal, you can do this with the Pro Prefer that is in that picture and that I'm holding, or you can do it with your fingers. So if you're doing it with your fingers, I washed my hands, but if you're doing it with your fingers, the way you would start is you would put your index finger in by the inside of the cheek, and then have your thumb pinch onto that index finger from the outside, like this, okay? What we're gonna do is a C-stretch. So we're going to stretch from the center of our cheek into our lip, okay? There are 4 different quadrants that we're going to do, and this helps get more medial lip closure from your cheeks and from your lips. Okay, again, this all lends into using a cup, using a straw, taking any food off of a spoon, and just activating the jaw and getting more and more movement, which is what we're looking for. So I'm going to do that again, and then I'll show you with the Pro Prefer. So you're going to put your index finger on the inside, thumb on the outside, and you're going to stretch a C stretch into the bottom lip and pull through the lip. You're going to do that 5 times, and then you're going to do the same thing on the top, on both sides, and the bottom. So I'll show you the top on this side as well. Go here, over, and into the top lip. And you can see me stretching and pulling. You should be stretching and pulling. It shouldn't just be a light, light, light touch. You need to actually get the muscle movement, okay? And then the same thing you could do with the Pro Prefer. If you don't want to use your fingers or a gloved finger, you can do the Pro Prefer where you go into the cheek, and then you're going to roll into the bottom lip. I'm trying to find a good angle. So you see, I think the fingers usually stretch better, in my opinion, but if you don't want to use your fingers, feel free to use this, and you can still get that input through the lip, okay? And you do that throughout the top as well. 1, 2, repeat 5 times, and do it on all 4 quadrants, okay? Okay, so our next exercises that we're going to do are for jaw biting, chewing activation. So the first one we will talk about is pressure to the teeth and the gums. After you finish doing the outside of the cheeks, after you finish doing the inside of the cheeks, we are going to, and our lips, we're going to go into the teeth. So the way I think about it, so I don't forget anything over time, is we're working from the outside in, right? Eventually we're going to get down to the tongue. So now we're working on our teeth. What you'll do is you can use, and so I use either the Z-Vibe, I've sometimes used my finger if the child doesn't have teeth, or if the child does not bite with a tonic bite. If the child obviously has a reflexive bite or anything like that, obviously avoid using your finger, but you can use your finger otherwise. If not, Z-Vibe Prefer or a toothbrush is fine. You're going to give firm pressure throughout all of the bottom teeth and then all of the top teeth like this. And then you'll do the same thing on the top. Oi. Okay. So this is to target jaw closure, munching, and biting pattern. If you think about it, I think about it in terms of if I'm exercising and I'm holding a resistance, like a dumbbell. With the resistance pushing down on my hand, my instinct is to push up, right? This is the same concept. If I'm pushing down on the teeth, the instinct or the muscle reaction starts to become to push against and resist and close the mouth. Same thing on the top. If you're pushing up, 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 you want to close and give that and get that input. So that's what we're looking for. If your child is having a hard time munching or biting or closing their jaw, this is a really great exercise to incorporate for that. And I didn't put how many repetitions because you can really just go throughout the whole jaw until you feel that you've gotten throughout a thorough pressure throughout. The next exercise is the gum massage. So rather than working on the teeth, you're going to do, and I do this with my finger, like in a gloved finger or using a toothette. You're going to, instead of going on the teeth, you're going to work on the gums. So you're going to start from the front and you're going to work in and push through, going through the gums on the bottom. Same thing, the gums on the top. Okay, and you can take this slow. I sing ABC songs, I sing regular, whatever is motivating to the child, just to keep it fun, keep it exciting, make it something that you're doing with them and make it a fun activity. If they're not tolerating this, sometimes 5 times is too many. You can always start with maybe 2 times, or try singing a song where once you get to the end of the song, then that's when the child knows you're going to stop. So if the child knows the expectation, or you tell them, okay, we're going to do 2 times, 1, 2, then oftentimes they're a little bit more apt to allowing you to get into their mouth if they just know the expectation or know at what point of a song you're stopping, things like that. So keep that in mind. And that's for all of these exercises, is something that you can incorporate, is the song and the counting, to help the child understand what you're doing and for how long you're going to be doing it. The next exercise is the bite assist. So for this one, you're going to place your index finger between the child's teeth. And again, if the child has a strong bite or a tonic reflexive bite, don't do this. You can do it, just use a tool like the Z-Vibe or using the Pro Prefer. And so the way this exercise works is you're going to put your index finger on between the child's molars and your thumb under the jaw. Okay? You're going to basically simulate a bite reaction. And so you're going to work through that 5 times. I sometimes do it more than 5 times. This one, I'm looking for the child to start initiating movement. And if they're not, I give deep pressure for that bite. And then I'll stop and wait to see if they anticipate more movement. Often you'll see when you're going through and you're counting, let's say you count to 10 every time, and on number 5 you stop for a moment and hesitate, you'll notice the child will try to start closing because they think you're going to continue all the way to 10. So this is a really nice exercise to get initiation of jaw movement, getting more of a coordinated pattern in jaw movement. So those are all exercises what I use this exercise for. What else? Yeah, and then I think that's it. Make sure you do this on the right and the left equally. Okay. Rhonda, am I going too fast, or are you guys okay?
I think we're good.
Okay, good. Let me know, please, if anybody has any questions or if I'm going too fast. I'd be happy to explain or slow down. Okay. Okay, so our next set of exercises are the tongue activation exercises. So like I said, we're working from the outside in. So our next set is on the tongue. So these exercises are probably some of the most common exercises that I do when we're not seeing appropriate tongue movement, whether it be for maintaining food on the teeth to chew, or it might be in order to get even a swallow, having the child pull their tongue back to form a swallow. So these are exercises that after I do all of the external and internal and teeth, then I'll work on the tongue. And if I need to, I will do these exercises more than 5 times just to create repetition and increase the exercise. Okay, so the first one is lateral tongue movement. So you start on the sides of the tongue. That's what lateral means, is the sides. So what you're going to do is Z-Vibe. You can use the Pro Prefer. This is the Z-Vibe, by the way. And this is the Pro Prefer. And I do have a toothette, which is just, like I said, it's a sponge. And so you can find these also on Amazon. All of these things you can. Okay. So you're going to provide firm pressure down the sides of the tongue, starting from the back by the molars all the way to the tongue tip. So I'm going to show you what that looks like. This exercise specifically helps the tongue learn how to move from side to side. And so again, this is important because when you take a bite of something, our tongue is supposed to move our food to the side so that we can chew it. And our tongue is supposed to maintain our food there and not let it fall back to the middle. So if our tongue is having a hard time doing our side to side motion, then that's where sometimes you'll notice a child will have food just in the center of their mouth and might be sucking on it, might be mashing it, or start to gag at times because they don't know what to do with the food and can't control it very well. So lateralizing the tongue is very important. This exercise, I'm going to use the ProPrefer. So I start at the back of the tongue, and I'm going to do a rolling motion down the side of the tongue 5 times. So bear with me. 1, 2, 3, and then so on, 4, 5, or you can do it even 10 times if the child tolerates it. And then after you do one side, just move on to the other side, do the same thing, and you could keep taking turns that way until you start to notice that the child might pull their tongue to the side or try to move maybe their tongue away from you, which is still a good movement to see. Even if they're trying to move away from you, they're still trying to get lateral movement to get to the other side. So there's a few different fun ways of catching how you can start to get the tongue lateralization. Next exercise is medial tongue stretch. So after you do all of your exercises on the sides of the tongue, you're going to do an exercise going from the back of the tongue in the middle, down pressure through the middle to the tongue tip. So this exercise specifically helps with tongue retraction, which means pulling the tongue back, which is necessary for a swallow. So what we would do is we'd go from the back of the tongue, put pressure, and roll down the center. I'm going to say that the Z vibe often comes with this little squared tip. If you can put the rounded tip on it, there's a yellow kind of rounded tip. This one is easier to roll down. If you don't have it, don't panic. Just keep the side down. Don't even roll it. Just give pressure down with the texture. But if you can, I prefer rolling. It gives more input. Okay, so you would do that down the center of the tongue. Again, you could do 5 to 10 times or more, depending on what the child will tolerate. And yes, and so let's see. I think I'm getting to this later, but just in case I'm going to touch upon it now, you can also dip your toothette or your Z vibe or your ProPrefer into some flavor at this point for the tongue lateralization or tongue medial stretch exercise. Sometimes I'll put a little bit of puree if the child can swallow purees, or if they can't, sometimes I'll even just maybe roll it in a little bit of like flavor of maybe bacon fat or a little bit of juice. I'll just dip it so that they have a little bit of the flavor of a strong juice, like cranberry juice, mango juice, anything like that. Just something with strong flavor that they could taste it, but they're not getting volume down. That might be unsafe for that child. Okay, so the third stretch in our tongue activation is, oh, I'm so sorry. This was an error. I will delete that. But just the first 2 are tongue activation. Okay, so this is a fun map that I came across that I use often with my families. It's a nice way of also knowing what type of flavors and tastes you can use and where to use them on the tongue to get the most input and sensory input for the child. So our tongues have a taste map where, and you can see the numbers of where certain flavors are felt and tasted the strongest. So the back of the tongue is where we have our most bitter receptors. So anything that you're going to give the child that maybe is a bit bitter, I've even used like bitters sprays and done that as a flavor in order to get some reaction. And I put that from the back of the tongue and roll it forward, and they'll taste it in the back of their tongue. You can do the sour on the sides of the tongue when you're doing lateralization. You can do salt as well on the sides of the tongue, but towards the front. And the sweet is where we taste on our tongue tip. So doing even that back of the tongue to the front where you swipe through the tongue tip, you'll taste more sweet that way as well. Okay, so now we're done with our oral motor exercises. The next slide is more so for if your child is starting to swallow more so or needs to increase their swallow strength, and they're able to show that lingual movement, but it's just not coordinated or not strong enough. Some exercises you can do are using a tooth at Z-Vibe prefer or toothbrush to provide pressure down the base of the tongue, rolling just like we talked about prior. But this is where I had mentioned that you can add the flavor, you can add the puree, and you could scrape it on the back of the tongue and then roll it forward to the tongue tip. And it just makes it easier for the child to swallow the puree rather than having to work around the mouth finding it. If you scrape it on the back, oftentimes you can get more volume in as well. And so yeah, using purees is a nice one for that. Another exercise with this is using a lollipop. So if your child needs repetitive drill-based swallows in order to increase strength and coordination, if they're able to stick their tongue out far enough, you can put a lollipop in front of their mouth. And I've done this with kiddos actually that don't put their tongue out too far at all, if only just in front of the teeth. When you can use the lollipop and brush it down the tip of their tongue so that they react and pull their tongue back to swallow. And then little by little, you'll start to notice the tongue coming out a little bit more and a little bit more to get more of that flavor from the lollipop until eventually they're sticking their tongue out like that little girl in the picture and then pulling their tongue back. So again, this is if your child has some range of movement with their tongue and we just need to increase the strength and the coordination of that swallow. Other exercises for chewing and biting include using chewy tubes, which is in that picture on the bottom right corner. Chewy tubes have been wonderful in so many of my sessions. I've started, so you can start with the red chewy tube, it's the easiest, and then work your way through to the yellow and then so forth to the other colors. Some exercises I do is I'll put the chewy tube between the child's teeth and I sing or count with them and I model and show them how I chew onto the chewy tube. The chewy tube, what it does is it gives a little bit of resistance. So again, just like regular exercise, a little bit of resistance helps build that muscle strength and coordination. So if they're able to bite all the way through it, then having those repetitive bites helps increase the strength of the bite. And if the child does not like the taste of the plastic, you can always add in some purees to the center. It's an actual tube, so you can put in some puree. You could put maybe a little bit of a dissolvable food like a puff or a meltable yogurt melts, putting those in there. And sometimes even hearing the crunch sound through the chewy tube is exciting for the child and makes them want to keep crunching more. Yeah, okay. I'm going to go to the next one. Okay, so here we have some modification tips. Our first modification, oh, hold on. Let me make sure I'm on the right ones. Okay, so thank you. Okay, so our first modification tip is with foods. So hard munchables are a great option when you're having the child first focus on a variety of the things that we've talked about. Tongue movement, lateralizing the tongue, chewing using their teeth. A hard munchable, though, just to explain it a little bit more, is considered an object that the child is not going to necessarily bite through. So you don't want the child to bite through this. That's why it would be either a whole carrot, a celery stick, jerky sticks, licorice sticks. Some people even do frozen bagel or French toast strips. Something that is considered almost like a bone in a way, where they're chewing on it, but nothing's breaking off. It's simply just practice chewing and practice having the tongue follow the food that is in their mouth without having to worry about chewing it or actually swallowing it. And it also provides the flavor and the texture of food without really needing to chew through the food. Another modification tip is using dips. So like we talked about before, you can dip purees and things like that, but also just finding really fun, high flavored dips that you can put on the different tools, or using dips with crackers or things like that that will fall apart easily. You can put a dip or something with it, or a sauce that helps keep it a little bit more cohesive in a ball. So when they're chewing or eating, the crackers or rice or whatever it may be is not just splayed throughout the mouth. It stays a little bit more in a ball together as they're chewing. The next tip is on juices. So if your child, has more difficulty swallowing thin liquids, something you can do to help them trial different strong flavors is dipping. You can always dip a towel or a blanket or something familiar in a strong flavor of juice, and have the child chew on it or suck on it. Or even the smell is important, just to even get the smell if your child doesn't even tolerate anything in their mouth yet. Just having the smell around them, or even wiping it around their face, is a great experience as well to add some of that sensory experience that we're looking for. Let's see if there's anything else. Okay. There was, do you mind, Rhonda, if I switch a screen really quickly?
Go right ahead.
Okay. Okay. Let's see. Okay. Let's see. Bear with me. There was a slide that, for whatever reason, didn't want to save to the PDF version. So I'm just going to make sure that you guys can see it. Okay. Almost. I can find the most recent one. Let's see. Okay, so I'm going to do, okay, here we go. Let's share this one. Okay. All right, so let me know if you can see this, okay?
Yes.
Okay, great. So let me make sure I touch upon the slide. Okay. So this, just present it a little bit bigger for you. Okay, can you see that okay, Rhonda?
Not yet. It says click to exit full screen is all I can see.
Let's do it this way.
That's
okay,
fine.
We'll go from here. This will be a little bit easier. All right. So these are different modification tips using tools. So some of the tools that I use often have the toothette, like I explained earlier, used to suck on liquids or roll puree flavor on lips, tongue, or cheeks. It's just a nice, less abrasive way of using something instead of the Z-Vibe or the Pro Prefer. Also the silicone spoons. So silicone spoons, I think, have changed my life in therapy, to be honest. I used to use so many hard plastic spoons and things like that. And then when I discovered silicone spoons and how children react to them is so much nicer at times, just because a lot of the children that, you know, we work with and a lot of our families have their children might, you know, bite with a tonic bite, or might just in general, you know, want to be able to bite and chew on something without it being something too hard that is difficult to chew on with like sensitive gums or sensitive teeth. And so the silicone spoons can act as both a teether and also to provide tastes and textures and flavors through the spoon. So some of my favorite ones, though, are Ola Baby, which is this top left corner spoon. The Munchkin spoons. The Munchkin spoons are on the top right corner. They have a little guard for the hand so that the child doesn't push the spoon too far in their mouth, but it also helps give a little bit more support if your child needs help holding the spoon. There's also these straps. I didn't list them here, but there's straps called Easy Holds. It's the letter E and letter Z holds that you can strap onto different utensils, and it straps onto the child's hand if you want your child to be able to, you know, hold on to it without you having to physically support their hand with the utensil. There's also the Chew Me Flexi Dips. These are fantastic. They're the top or the bottom left corner too, that they have a little space with little holes that help hold the food so that it doesn't fall out as easily off of the spoon, and is another opportunity for the child to chew and suck on those Chew Me spoons. And then to the bottom right are the Vital Baby spoons. And these, they don't look like it so much in the picture, but they're actually pretty narrow and they're flexible. So if it's difficult to get into the child's mouth with a wider spoon, these guys are beautiful because they're narrower and just smaller spoon. But and they come in a big pack, so you won't run out. And then on to the right, we have syringes. So syringes I've used often even if I'm working on spoon feeding with a child, but we're not able to get in enough food using a spoon or using a toothette. Syringes sometimes are a nice way of bypassing the front of the mouth and getting through the side of the cheek to the back of the mouth to provide more puree or more liquid to get in the volume. So if your child is safe to swallow but are just having a hard time getting the food to the back of the mouth and keep spitting it out, you can work on the exercises that we talked about or use a spoon feeding, but in between some of those, you can also use the syringe to just get in some extra volume while your child is practicing swallowing with and getting the food to the back of their mouth. And I didn't list it, but something else I really wanted to incorporate was using the use of things at home, like a rubber spatula, a whisk, or things like that. You would never think to use it, but so many kids have so much fun just thinking of, you know, these cooking utensils that are off limits usually to them. If using purees or different flavors on some of these big rubber spatulas, it sometimes is a fun, nice way of exploring with the mouth. That I've provided spatulas to some of my kiddos, and that's when they've tried some foods that they might have never tried before, just because it's on a fun new tool. And because they're rubber and they're softer and they're bigger, so they can put their whole mouth on it. Their tongue can explore more throughout. It's a nice option that sometimes we don't think about that we have in our own kitchen. Okay, some other modification tips are using a head pod. So a head pod is it's a device that's used that can be it's fitted to the child's individual chair and fitted to the child's head. And so what it does is it's not supposed to be a permanent solution to just having the child with a head pod necessarily all the time. I think some people do, but if it's, in my experience, we've used it more so with specific activities when the child wants to have a little bit less thought about holding their head or the supporting their head, and you want the child to focus in on a specific activity. So this is used in schools and things like that. But with feeding, it's a beautiful tool just because, again, you can allow the child to have that proper alignment and posture as it's helping hold their head steady a bit more. And they could still turn their head. It just helps suspend their head a little bit easier. And it's a nice way of taking the pressure off so they can have the alignment when you're feeding them or doing these exercises. And to the right is a little hack that I use of if your child has maybe vision impairments or CVI, tying a small, red bow or a band or even a red bell or something like that. Usually the color red is really catching to the eye, especially for children with vision impairments or CVI. So putting that on the spoon and using that as a presentation with a spoon helps the child localize where the spoon is, and that way they could prepare their mouth better if you're going to be giving them a taste of something. Or even with the tools, when you're doing exercises, the child can see the tool coming and it doesn't catch them off guard if you're able to put something on it. I've also seen families put like little light up lights strapped on that they found on Amazon. And those worked beautifully as well. And you can tell the child catching their eye with the lights or the colors. And okay, let's go on to, let's see. Okay. So we're coming close to the end, but I wanted to incorporate some tips for feeding practice at home. Obviously, all of these exercises have been exercises for feeding practice at home, but these are kind of like the nice 10 tips to keep in mind that I have families post on the refrigerator or on their dining room table when it comes to feeding. And so the first one is all manners out the door. When you're trying to work with your child and you're showing them how to eat or how to chew or different things like that, don't worry so much about, wiping their mouth so much or making sure everything's clean or making sure that you're chewing with your mouth closed or anything like that. Honestly, the more that they can see and the more they experience with touch and texture and smell and temperatures, the better to increase that sensation. So let them see how you eat. If you're trying to show your child, this is how mommy chews or this is how daddy chews, and you open your mouth and really show them what you're doing with your tongue and your teeth and your cheeks. Not only is it kind of fun and funny to them and exciting, but it just opens their eyes a little bit more to what's going on in the mouth that sometimes is very difficult for them to understand or see on a regular basis. And if your child has a hard time seeing that, you can even help them by touching on your face or feeling it as well. So number 2 is start mealtime slow. So whether it be even working with just exercises, if your child is not eating by mouth, or if your child is starting to take in some food by mouth or is fully eating by mouth, start slow, make it fun. You can always start with a hand washing exercise or using a wet towel to wipe their hands and sing a song, and then incorporate getting the towel or your hands working up to their mouth, and then do the exercises so that it feels safe and it feels fun. And you're not just going straight into their mouth to do something and throwing them off a little bit. Number 3 is you pick one spot in the house. So try your best, instead of having, your child on the couch, by the dining room table, on the floor, in their bed, in different places, eating or drinking, try to find one spot in the house where that becomes the child's routine. And sometimes having that routine gets the child excited because they know what to expect, and it makes it a little bit more predictable for them. And by all means, if the child also has a negative association with a specific spot, you can always try changing up the positioning of where your child is or where they're eating, to start from scratch with some of these exercises and techniques that I'm showing you. Number 4 is following the 90-90-90 rule, which is basically what we talked about with our posture and alignment. If your child is sitting with a 90-degree angle at their hips, 90-degree angle at their knees, 90-degree angle at their ankles, then they will have a good alignment sitting in the chair. If their legs are dangling, they're not going to have that 90-degree angle. You need to make sure to give them some support on their legs or their feet, so they're not having to worry about their legs moving or their trunk falling over or anything like that. They're well supported and just thinking about their mouth and what they need to be doing with their mouth. Number 5. So is exposing your child to varying tastes, smells, and textures. We've talked a lot about that, making sure that you're not just focusing necessarily on one thing, but you're giving them experience, even if it's just smelling. You know, sitting at the dinner table and having your child sit there as well, even if they're G-tube fed, is super important, where they can smell the different smells and they can maybe have a few little bit tastes on their lips or on their cheeks to feel the texture, or the temperature. Those are all really nice, and often really cultural type experiences that help, you know, make the family feel together, and it's part of fun and excitement in eating. So sometimes that even comes before actual eating in and of its own, starting with something like that. Number 6, creating a fun, positive routine to start and end meals. We touched upon that a little bit, but if your child is having a hard time through their meal, you know, obviously we start the meal as best as we can with, you know, a fun song or a cleaning your hands routine or something like that, or making the plate look fun, adding different colors and textures. But ending it is just as important. If the child is having a difficult time because the experience is too strong for them or too much for them, end it well. It can simply be a goodbye song to say bye to all the foods, and the child can maybe help you put the foods in a garbage can or in an all done bowl that you just have there, and whatever goes in the all done bowl they never have to touch again during that meal. Just ending it where the pressure is off and they can feel confident and happy, maybe giving the foods a kiss goodbye, or mom or dad are giving a kiss goodbye, just making it a fun transition out rather than stopping right when they're upset or crying. So just keep that in mind so that the next session or the next feeding experience starts positive again too. Number 7 is a given, make food fun. As I've talked about, kids learn through play. So by all means, you don't have to distract the child with a song and a dance. That's not the best idea either, because you want them to be interested and experiencing the food rather than your song and dance. But just make the food fun. You can, if you have the time, you can always cut the foods into fun different shapes. You can always use fun utensils like I talked about. Or even sometimes I'll pretend the foods are certain characters and things like that, and just make it interesting and fun for them. Number 8 is hosting your own Master Chef Junior. Getting kids, and that's really just getting kids in the kitchen and helping you. There's some adapted equipment as well that's interesting to use with switches to help mix foods. You can have the child even just hand over hand help you mix things, help you put things together. The idea of helping without the pressure of eating is sometimes really exciting and a nice experience to get kids starting to want to eat, or starting to want to even taste or smell foods, just by getting them to help you make something without even the pressure of eating it. Number 9 is thinking outside of the box. So instead of constantly telling them, this is yummy, this is so good, this is delicious, when you're giving them tastes or smells or anything like that, try to think outside of the box and talk about texture, talk about flavor, talk about temperature of foods, and you'll notice it gives you so much more to talk about when you're talking about the foods themselves and what they smell or taste or or feel like. And it oftentimes gets your child to feel a little bit more confident knowing what to expect out of the food if they're going to try it. Rather than just hearing yummy and then they try it, and if they don't like it, the next food that they hear, oh, this is yummy, they're not going to want to eat it. So try to avoid the yummy. I still do it here and there because sometimes you just can't help it, but try very hard to just think of other ways of talking about foods in order to get a child interested in the foods. And last but not least is treat yourself. So families, I've seen so many families over the years so stressed out of their minds, and you guys work so hard, and therapists as well, work so hard in trying to get your child through this journey of eating and swallowing and everything that comes with it, that make sure to give yourself a pat on the back and know that you're doing great no matter what stage you're in of feeding and swallowing. That just make sure that you know that every parent, I think, is doing the best they can. And as long as, and you're here and you're learning. And so as long as you just keep learning and with experience and trial and error, you start to figure things out. So just make sure to treat yourself, give yourself a pat on the back, go enjoy a massage, and just keep that in mind as well. That's important. And now we're coming to the very end, where you can find some extra resources of help. There's websites that help you find different therapists in your area. Feeding Matters is a great one. That is a parent-run support group for families of children with feeding difficulties. You can request a peer mentor to have someone to talk to if you need that support. Feeding Flock is another one. It's a research team that's dedicated to partnering with families to nurture children with feeding difficulties. They have a Facebook group as well that you are invited to go into. Pediatric dysphagia, that's a Facebook group. So pediatric dysphagia, babies with swallowing feeding difficulties, there's plenty. There's so many feeding Facebook groups. There's also for G-tube fed kids, there's blended diet Facebook groups as well that families share ideas on creating blended diets and their experiences with it. Feeding Tube Awareness is a great website. And Pediatric Feeding News is another beautiful website or a blog that provides up-to-date and current information related to pediatric feeding and swallowing problems. Trying to make this rapid so that you guys are not here for too long. And our last slide is where to find help. Instagram has so many resources now as well. I follow so many Instagram accounts related to feeding that I always think to myself, I'm like, if families followed some of these, I think they can almost just even get ideas of therapy throughout, their everyday. So there's some examples there. NAPA Center is a great resource as well. We have feeding specialists like I've mentioned, and we do our intensives and traditional therapies. We have our clinic in Austin, and it just opened September, so not even October. It's opened already. So feel free to talk with one of us. My email, I believe, is going to be sent to you through Rhonda or Mickey as well. You might have met Mickey in our past presentation. And so feel free to reach out to us if you have any questions or concerns regarding anything. And what else to do? Oh, yes. Something else I was going to mention, and this I find really important, is if you're feeling like you're having a hard time, being able to manage the stress that comes sometimes with, caring for a child with feeding and swallowing difficulties, make sure to reach out to someone, or reach out to a doctor, reach out to a therapist, or someone just to help you kind of work your way through understanding what you can do different or what you can do more of, or just to even tell you, you're doing all the right things, just keep moving forward. And it's a long process, but you've got this. So we're here to listen and just reach out for anything, please, truly. And I think that is it. So now is for any questions or thoughts or anything, we can always go in the chat. I think about that.
I'm thinking you were so thorough that there's no question. You were
Yay!
A little bit longer. Let's see. Oh, go ahead, Nancy.
My question is, because we're working with the sensory part of it, in which she has actually really progressed in the last 4 days. But like just now, I was following you using her, and she was okay with like stimulating the inside of her cheek by putting my finger and my thumb on one side, and then she was like, okay, enough. So do you stop there or do you continue?
So what I would do is if it's too much for the child in that moment, let's say you got, how many, did you get into one stretch?
Just one stretch on the right side. And then she kind of like laughed and and she swatted her hand on my hand, like to, stop. So I didn't want to push her, so I stopped right there. But I'm always about symmetry. So I was wondering, should I try to do the left side one time?
So what you can try to do is, I call it a dance. So find a way that you can take a tiny step back to get her a little bit more comfortable. So maybe going too far into the cheek was uncomfortable. See if she'll let you do the same exercise, maybe on the corner of her mouth by her lip, or even just on the lip. And then get excited, and praise her a little bit or make it fun if she was okay with it. So if she let you do a little swipe on her lip and tell her, oh, that was fun, or that was squishy, or something to make it kind of a calm, exciting situation, and then see how far you can work it. And if she doesn't let you go any further today, you're going to try it again the next day.
Okay.
And each day she'll let you go further and further as she feels comfortable and more confident that she knows what you're doing and that you're not going to push her limit.
Okay.
So if you push too much, the next time she might not really let you do it too much. And so what you would do is take a step back and just do the outside, and you'll feel more comfortable and confident. And then little by little, you can work back in.
Gotcha. It makes sense. I don't want to overstep, because that's the whole reason why we're here.
Definitely. I'm glad you asked that question, because that is something that, especially when a child is very sensitive, especially going into their mouth, start with the outside and make sure that they feel safe and comfortable with that. And even if they don't, like I said, you can use a familiar blanket or something that you can rub on their cheek to let them feel comfortable. And then you can even start to work that a little bit on their lip or the inside, and then start to work into the cheek.
Okay. Well, I appreciate this. This was very informative. We got some tools to buy.
I'm glad. Good to hear. And by all means, don't feel the need to buy everything. I always feel bad when families are like, look at my Amazon cart, and they have like 20 things. Like, just start little by little. And if you have something at home that makes you as well, then by all means use it.
Cool. Okay. Thank you. I appreciate it.
You're very welcome.
Thank you so much, Katrina. Are you going to send me the PowerPoint?
Yes. So I'll send you the PowerPoint right after this.
Perfect.
And I'm not sure if it would be helpful to send larger video of me doing the exercises, or if families.
If you're willing to do it, then I'm sure it would be super helpful for not only the people on this call, but people that weren't able to join us too.
Okay, sounds good. I know it's such a small little video, I think, of me doing it. So I'll through probably next week I'll make it. Because this week is a little bit packed, but next week I'll do that and I'll send it to you.
Okay, thank you so much.
You're welcome. And the postural alignment ones as well.
Perfect. Well, y'all have a wonderful evening.
You too, Rhonda. Thank you very much. You always have the best.
Okay, perfect.
Bye, guys.
Bye, guys.